we're now going to move on to our next session, staying with the theme of collaboration. I'm very pleased to welcome Dr. Teresinha Evangelista, a very experienced consultant, neurologist, researcher, teacher, also served on many advisory boards. And today she's going to talk to us about the European reference networks. Thank you very much.
Thank you for the invitation. It's a pleasure to be here. I have quite a lot of friends in this room. And well, what Michaela asked me was to talk about a project that has now more than 7 years. And it's been 7 years of my life and quite hard. It's the European reference networks, and in particular about for neuromuscular diseases. So for the ones that are not aware of what European reference networks are virtual networks that put together healthcare professionals and patients. And the aim is, due to the rarity of patients and healthcare professionals, experts in rare diseases, to put together to those people and try to overcome the problems associated with rare and complex diseases and diseases that require highly specialized treatment. And from the beginning, pooling resources and knowledge is a way of overcoming these problems. The ERNs were launched in 2017. There are 24 thematic ERNs. Now, at present, we have more than 1,600 healthcare units in total in 400 hospitals that cover, I think that by now, all the EU member states and plus Norway, which I think it's really huge. So one of the ERNs, as I said, is the ERN for rare neuromuscular diseases that I coordinate. We had a rough time. It all started when I was in Newcastle, and it was Newcastle, the coordinating center, and with Professor Kate Bushby, and also with the help of Hans Lockmuller. And then there was the Brexit, and the ERN had to move houses, and it moved to Paris, to the Pitié-Salpêtrière Hospital with the help of the Institute of Myology. And I've been coordinating the ERN since from there on. The way the ERN was structured or is structured is around the major disease groups in the neuromuscular field. So we have working groups for muscle, for peripheral nerve, neuromuscular junction, motor neuron disease, and mitochondrial diseases. And then we have cross-cutting groups, because all these diseases need experts in imaging, in pathology, in neurophysiology, genetics. And now we have created, this is quite recent, a multidisciplinary treatment and care working group. So these are basically the transversal transversal support for the pillars that are the disease groups. And then, as in other projects, we have advisory boards for education, research, and a patient advisory board that is a little bit more than a patient advisory board, because they are quite active and quite implicated in the ERN, as Michaela well know, because she's part of it. The governance, I think this diagram is quite complex. It's part of the complexity of what the European Commission puts on our shoulders. So we had very clear governance structures. So we have to report to the European Commission, to the DG Santé and to ADEA, but also to something that is called the board of the member states. And this communication is done by the coordination team in Paris. And the coordination team communicates, but it receives the main directives from the executive committee of the ERN. And the executive committee is composed of people from each one of these working groups. To make things a little bit still more complicated, we have a network board. We have 84 centers now, and 18 patient representatives. And they all are part of the board of the network, and they all have a decision power if they want to use it. And we have created together with what we call the neuro ERNs, which is rare neurological diseases and epicare for rare epilepsies. Still another branch, which is the cross ERN working groups, and I will talk about it after. So moving from that really difficult slide for me, I don't like to explain it, but I have to. We are now under a new funding from the European Commission with the new grant started in October 2023, and it goes until 2027, so it's 48 months of funding. The maximum grant amount is 3,225,000 per project, so per ERN. And there was a novelty from the side of the European Commission that up to now they only allowed mono-beneficiary grants. So it was only one center that was coordinating the money. Now they allowed us to have multi-beneficiaries. So we decided to have 5 partners. So the coordinating center and for others. And you can see in this slide the work packages. So these ones are mandatory and they need to be run by the coordinating center. So it's coordination, dissemination, and evaluation. And I think that all the other work packages show you the range of activities that there are in the ERN. So we have one work package that is about healthcare and let's say e-medicine. Another one, it's about the registry, and I will talk about it. Training and education, that is very strong. And we had an evaluation, the 5-year evaluation, and this was our strongest point in the evaluation. We had a very good one, and this was outstanding, I can say. And we have another one about clinical decision tools, about Ukrainian activities and research promotion and needs. And this, I'm really happy that Daria spoke before me, because this is the work package where we do the interaction with all the European research projects that we try to have the ERN in, because it's important for our members. So like Erdera, like Erica, like it was Solvardi and so many others. So this is really to promote research and to try to figure out what are the needs of our community for this in this case. So this is a very short presentation about the work packages. And as you saw in the previous slide, we have many activities, and I decided to focus on 4, which is the care. The care is should be the main part of the ERNs, because we are not research, we are about care, except that in rare diseases, care and research came along together. I will talk a little bit about the ERN registry, about our educational activities, and the fact that even if we are working on neuromuscular diseases, we are still in need to collaborate with the other ERNs, especially the ones that have overlapping areas with ours. So we create the inter-ERN working groups. And so I start with the first point, which is about care. And from the beginning, the European Commission created a tool. It's called the Clinical Patient Management System, which is basically virtual collaborative tool that allows the clinicians in the different centers to discuss clinical cases. And to discuss these clinical cases with a software that is safe, is secure, so there are no problems about the privacy of the patient. It allows us a lot of things like sharing medical images and so on. And we can not only use it to share patients or share patients' data and difficult cases in our own ERN, but we can do it across ERNs, and we can even have invited centers, or it means that it's centers that are not part of the ERN and that they need to discuss a particular patient, a particular case that is very difficult, and we can use this the CPMS tool to do that, to improve the diagnostic and the treatment of the patients. So in theory, what happens is that the patient goes to the primary care physician. The primary care physician will refer it to a specialist. If needed, it goes up to the referral to the ERN expert center, and it should be usually one of the clinicians at the ERN expert center that would refer for the CPMS and for those panels between specialists. Well, I pass from one side to the other. One of the projects that gave me more pleasure was to be involved in the development of the Euro NMD Registry. So we have now, and now I can say we have now, because it's there, a registry for all rare neuromuscular diseases that includes undiagnosed patients that for me are really needed. And we can do a lot of research, and all the members of the ERN can do a lot of research if we achieve to have good numbers of patients from, well, at least from 82 centers in Europe. It's not bad. And besides that, we know that in the neuromuscular field, there are a lot of registries already. And disease-specific registries, national databases, and people are not very keen on putting data twice in the ERN registry and in the national database. So we not only are talking with those national registries to try to collaborate amongst ourselves, but we have developed the concept of a hub that connects several dots. We have our registry, but it also connects several. At present, it's 4 disease-specific registries, so that we don't share data like that, but we are interoperable. And I think that Noelle Laloute, she will talk a little bit more about it afterwards. So I won't go further like that. So we have the registry, and we have a hub of registries associated that will make the queries about a rare disease really much easier and more productive. In this registry, there are some mandatory data sets that are imposed by the European Commission. It's called the Common Data Sets, or the JRC minimum data set. We also created ourselves the Common Neuromuscular Data Set, so the common questions for all neuromuscular diseases. And then we divided it's not a sub-registry, it's in the same registry, but we have sub-data sets by disease group. So we have one for muscle, for nerve, and so on. So there are 3 main data sets in the registry. Just pass through this. These are the mandatory ones from the European Commission. 16. I'm not going to read through it. And as I said, we have the subsets for disease groups: neuropathies, myopathies, mitochondrial, neuromuscular, motor neuron, and undiagnosed. Well, we are trying to make our best to help our centers to upload bulk data. And besides the manual data entry, that is normal. And the registry is hosted by Freiburg, and it was implemented in a REDCap system, so it's not over difficult. I won't talk about the FAIR because Noelle will talk about it, but the registry was made according to the FAIR principles. And I will skip to training and education. That is one of the aims of the ERN, and it's one of our goals. We have developed several educational activities. Actually, we participate, and Michele also, in the MOOC on translational research at the EGP. It's also one participation of the ERN. And we have a lot of online trainings with a lot of webinars. This is our most recent series. It's about gene therapy, and we will have like 7 webinars, thematic webinars. We made a huge effort to make the webinars more structured and have these thematic ones. We are using the webinars and reusing them and transform them in podcasts, and you will see what we do about this. And we are collaborating for those webinars with the other ERNs. We have recently launched also a Moodle platform, and we already have one e-learning course online about mitochondrial diseases. We can eventually do one on GNE myopathy. If you all collaborate for it, it would be great. And we are, actually, it's Antonio that is working to have it accredited so that we can, so that clinicians in Europe, especially clinicians, can have those credits for doing these trainings. So our webinars are transformed into podcasts, and it happens that I have a very good friend that is sitting at the end of the room, that is Ukrainian. And well, we all use our friends to make things, and I didn't use her, but I just asked her if she could help us and help her country with some basic podcasts about basic aspects of management of rare diseases. So Oksana Pogoryelova, I don't know if I said her name, she's over there. She helped with the translation, and she is a native language speaker, so she did the idea, and this is the process to do the podcasts. And we are happy to, if someone wants to transform to another language that you think, just let us know. But anyhow, this is our way to help our Ukrainian colleagues and our Ukrainian patients. We'd also do on-site trainings. This is already the 6th edition, so it's there from the beginning. It's quite successful. It's a translational summer school. It's always organized in Leiden. I have the help of Annemika Asmerus she's there actually, in the organization of the translational summer school. The next one will be the 9th to 12th of July. And we have opened the registrations. Another that is going to, this is new. It's on the multidisciplinary management of neuromuscular diseases. It will be done also, this one will be in Marseille. And it's a very interesting program that addresses, even if we are not talking about gene therapy and all those diseases, we need to go back to the basics to keep our patients well, to get the gene therapy. So this is about that. And my last, so the inter-ERN working groups were started by our ERN, rare neurological diseases and epicare, and we have captured a couple of others. I just put here ERNI and Metaburn, with whom we work quite a lot. And these are some of the areas of crosswork in these 3 ERNs. We are trying to do European curriculum for rare neurological diseases, and it's ongoing. We have a lot of work done on mitochondrial diseases, guidelines, a webinar, and so on. Go and check the new website on channelopathies. I think is now online. And you see here what we are doing. And whoops, I was going to thank my team in Paris over there. I would like to thank also, I didn't put all the names, but I put the institutions, the registry consortium. And as you know, there are 4 hospitals and as many patient organizations involved in this work, and our contacts.